Doctors of Reddit, what is the weirdest thing a patient wouldn't admit? Not a doctor but a nurse, had a patient come in with a toothpick in his slong, refused to tell me how it got in there, insisting he was picking his teeth and it fell in. Being pregnant and also a virgin, people actually believe women can get inseminated in a public pool or after their parents had happy fun time in the jacuzzi and the girl uses the jacuzzi and is inseminated by the father. I admitted a guy for chest pain. As part of the workup, I did a urine drug screen which came back positive for cocaine. After the rest of his cardiac workup was negative, I said to him, "Good news, you didn't have a heart attack. It's likely that your chest pain was caused by cocaine." His answer, "I didn't use cocaine. See, I was at a party and people had some lines of cocaine out on a table. As I was walking by, an oscillating fan blew the cocaine into my face, which is why my urine was positive, MMMHMM. Got it. Nurse here. Had parents bring their 3-year-old son to the emergency department for 1 month of abdominal pain that kept getting worse. I ask all the routine questions for this complaint, lots of questions about his poop. Is it bloody? Diarrhea? Mucus? When was his last bowel movement? Any changes in the stool? They deny any other concerning symptoms but abdominal pain. We do blood work, ultrasound, X-ray, everything comes back completely normal but the kid is intermittently screaming in pain, curled in a ball. Over the next 5 hours I continue to repeat the same questions. I asked repeatedly if there was anything else going on that they could think of. Nope, the kid just doesn't seem well but we have no reason to keep him. We decide to watch him a little longer, let him eat. The kid eats a bunch, a PBJ, apple juice, crackers, popsicle, no pain so we decide to send them home. I bring in the discharge paperwork and I'm about to start going over instructions and dad goes, "You know, for the past 3 months he's had a lot of worms in his poop, worms, fluffing worms. You spent 6+ hours denying worms." I literally just turned around and walked out of the room without saying a word. I was laughing almost to the point of tears, could not wait to tell my resident, deworming medications, a garbage load of wasted time, and they were on their way. One of my lecturers told us a story of when he worked in ed. There was a man who refused to acknowledge or tell them how a jar got stuck in his rectum. They were taking him to the OR as it has created a vacuum seal and couldn't be removed without shattering but realized his BSL, blood sugar level, was off the charts. Really high. They were considering postponing the surgery to work out WTF was going on. When he ended up talking he told them the jar was full of honey before it got lodged, and was rapidly absorbed by the rectum, causing the insane levels. What? I'm a pediatric dentist, so maybe not the type of doctor you were looking for, but this one throws me for a loop every time so I'll share it. When I sedate kids they have to be NPO for 8 hours before, so I always ask if they had anything to eat or drink in the morning. Parents never want to admit their kid ate or drank, even when I remind them it's very important because if they vomit and aspirate they could die. Often they try to minimize it and say it was just a few bites, but one kid walked in eating a bag of Cheetos at reception and then the parent insisted to me that they hadn't eaten. Yeah, I'm 100% not sedating your child today. Obligatory. Not a doctor, I'm a nurse. We had a patient come into the operating room for brain surgery, probably a mid-50s guy with a nice head of light brown hair. Before a patient comes into the actual OR we ask them a series of questions, including whether they have any implants, jewelry, non-hospital clothes on, etc. Guy says no to all the questions. After the patient gets put to sleep, the surgeon grabbed his hair to start shaving it off because brain surgery, and all his hair peeled off because he was wearing a wig and didn't tell us. We almost shaved his hair piece because he wouldn't admit to anyone he wore it. Nurse here, had a patient accuse me of garbageting in her bed, and threatened to sue me for malpractice. Keynote, she never got out of her bed. Had a patient in hospital, I forget what for, the point is that he disappeared for a few hours. When he came back he was tachycardic to 160 BPM, massive pupils, couldn't sit still. We asked him what he'd taken while he was out. Nothing, he swears. He went to the puban, just drank lemonade. Okay, we say, we're gonna take some blood and find out what you've taken. He then pipes up the friends he was with would think it was funny to spike his drink. What? We asked, did he think they might have spiked his drink with speed? He says. What do you know? Bloods confirmed that he had taken speed, but he insists he didn't take it, his drink was spiked. I guess it's not super weird that this patient wouldn't admit this, but it's weird in the sense that it was super obvious what happened so he might as well just admit it. I used to do patient registration in the ER. 2 of us were wheeling around our computers and registering patients off of ambulances and getting patient information in rooms. A middle-aged guy comes in on an ambulance and my coworker takes it. So I'm finishing up some paperwork and I go to our front office and pull up the patient tracker board so I can see what still needs to be done, and a new patient pops up on the board. Chief complaint, eyeliner pens stuck in slong. My coworker walks into the office looking scarred. She explained. The nurse asked him what happened and he said he slipped. She told him that doesn't seem likely, so he said he had an itch and thought it would help. We later found out from the nurse that he finally admitted that he saw it on TV and thought it would feel good. His 20-something-year-old daughter was with him, but she clearly had some form of developmental disability. It was all around a sad situation, and I hope someone told him about sounding, and he did some research on safe practices for kinks, fetishes. Apparently they were both lodged in there pretty badly, and #X200B, edited for clarity, sorry lol. This one is sad. From my old roommate, girl had a very large lump on her breast that she didn't tell the doctors about. She actually went to the hospital for migraines, saying they were getting increasingly bad. When they found the lump, they asked why she didn't say she had that. She said she knew it was going to kill her eventually, but she just wanted to get rid of the migraines because they giving her a lot of pain in her last months. They were almost 60 years old and taking a drug to make them lactate so their husband could pump them as it would help their fibromyalgia, and #X200B took a while for them to admit why they were taking it. That they don't know how to read. I've been taught the trick of handing a paper upside down to them to see if they can read. It's good to know if they don't, so you can make extra sure they have a full understanding of their instructions instead of saying to read the details on the sheet. I'm a nurse. I had a kid once who I needed to get a urine sample from. He was 8. I gave him a cup and pointed him to the bathroom. I went to check on my other patients and came back. Kid was still in the bathroom. I go knock on the door. Hey buddy, you okay in there? Sink on full blast. Yep. Everything's fine. I go back to his room a few minutes later and he hands me a bag full of water with a cup inside that also appears to be water. I pour the water out of the bag. Hey buddy, are you sure this is urine in this cup? Yay. My pee is always clear. PT is wheeled off the X-ray. I check the temperature of the so-called urine in the cup. It was ironically the same temperature as the water from the faucet. Come on little homie, you gotta do better than that. When was their last meal? They think they can fool their PET scan, end up losing money, time and over-irradiated. That she could actually see. We had this lady that came into the at least once per month, usually cheek pain. She was 30s, morbidly obese. She had seen multiple specialists, had her heart, lungs, GI system examined in almost every conceivable way. One night she comes in with sudden onset blindness. Not her first time with this complaint either. Last time she got a trip to the retina specialist. When I examine her, I walk around her bed and she tells her friend to get her feet off the chair so I can get by. She plays it off super cool by adding, if you have your feet up like you always do, then the neuro exam. I have her touch her nose then touch my finger. Her idea of how a blind person would perform this exam is to touch her nose then wobble her hand from side to side as she touched the end of my finger. Not to mention the near constant eye contact as we talked. I would ask a question and start moving while she talked and she would follow my eye perfectly. She was extremely relieved to find out she had conversion disorder and that her sight would be back soon. Edit, maybe it was factitus disorder. I tend to believe all her chest pains and crazy complaints were real feelings she was having due to a number of her social, psych issues. In the at midnight it's a lot easier to tell her it is a symptom of dealing with whatever social drama was happening in her life and that her eyes worked fine instead of telling her she was lying to me for some gain. Either way she was sick and needed reassurance. She was genuinely relieved though. On the finger-to-nose test she touched my finger on the first try, but instead of a straight line she moved her hand back and forth about the 3 inches the whole way there, but directly there. My finger was probably 2 feet in front of her face. Other than all the random things that end up in rectums accidentally, drunk electrician with the longest drill bit I've ever seen sticking through both legs and impaling his scrotum in between like a really gross kebab. He was so drunk he thought he broke his hip, denied owning any drill bits or for that matter having been drinking. Most common are the numerous drug tox screens we do that come back positive for something and everyone is shocked, borderline offended it got into their system. Once had a woman come in for a possible yeast infection. On exam she had a glass bottle stuck in her meowl filled with urine, totally wouldn't admit it was hers or explain how it got there even after we removed it. Just kept saying, I think this is all a joke and you put it up there. I volunteer at an prisoner shoved a ball-point pen up his urethra to get out of being stabbed. IIRC insisted he had no idea how it got there. We spent hours deliberating how to get it out, and he just reaches down, still in his handcuffs, and pulls it out himself. Edit, you can't get stabbed if you're not in the prison, and any sort of self-harm will land you on suicide watch, which is brutal as well. Weird happy fun time stuff though, no problem.